helping make your life easier. Moms Every Day.
Welcome to Moms Every Day. I'm Hattie Cheek. With us today we have Dr. Gerard Oakley from Comprehensive Cancer Center at Cabell Huntington Hospital. Thank you for joining us today.
My pleasure.
And we're talking cervical health today. It is the National Cervical Cancer Screening Month.
Yes,
Okay.
Cancer Awareness Month, yeah.
All right, so cervical cancer, what is it?
Well, cervical cancer is a cancer that obviously starts in the cervix. The cervix is kind of the lower part of the uterus that protrudes into the vagina. When we're doing pap smears, that's where we obtain the cells from for a pap smear. And unfortunately, there's a virus called human papillomavirus that can infect the cervix and the cells of the cervix and ultimately cause changes that can become cancerous.
Now, but what exactly is it that causes cervical cancer? What kind of things, behaviors?
Well, behaviors or risk factors, I guess, are age at early first intercourse, multiple partners having intercourse with multiple partners. Of course, having intercourse with people who've had intercourse with multiple partners. So it's a sexually transmitted virus that causes the disease. Some of the symptoms or signs that a woman might be having trouble typically are some kind of irregular bleeding or abnormal bleeding, bleeding after intercourse, sometimes a discharge that may be very watery, thin and watery, and frequently has kind of an unpleasant odor. Are probably the big things. So there can also be things like pelvic pain. And cervix cancer, because the cervix is so close to the bladder, can also kind of mimic bladder infections and things like that.
So many different symptoms that you could experience, so anything really, head to the doctor to get checked out, right?
Correct.
But how is it diagnosed?
Typically, we may be able to see the cancer when we do an exam, when your gynecologist does an exam.
Oh.
You may be able to, but more likely we pick up some of the abnormal cells on a pap smear. So obviously the critical test for cervical health is a pap smear.
And is this one of the things you said you can see it? Is it easily diagnosed if you just go get checked out?
Well, like I said, sometimes we can see it, but not always.
Okay.
And a lot of times we just pick up the abnormal cells on a pap smear. And so then there's a certain sequence of events that occurs in women or the procedures that have to be done for women who have abnormal pap smears. There's things called colposcopies and biopsies and things like that that would then lead us to make the diagnosis of cancer. Even more importantly, though, what a pap smear allows us to do is to identify cell changes that are occurring in the cervix before they become cancer.
Right.
And so that we have many more treatment options as far as getting rid of those abnormal cells and preventing them from ultimately becoming cancer.
And right, which leads me to my next question. How frequently should you be getting these pap smears, since they can prevent so much, or at least lead you in the right direction when something is wrong?
It's very, well, 20 years ago I would have said, oh, every year, you need to have a pap smear every year. But now things are, the task forces and the American College of Obstetrics and Gynecology are actually looking at how often someone needs to go for pap smears. Right now the recommendation is probably every 2 or 3 years to get a pap smear. So the annual pap smear is sort of like becoming a thing of the past.
Interesting.
Except for women who've had abnormal pap smears before. So anyone who, a woman who's been having pap smears, everything's been fine, probably every 2 or 3 years is appropriate. But the best person for each individual to decide how often they should go back to and get pap smears is probably just discussing that directly with your doctor when you see them.
Okay, and what age should they start going for moms who want to get their daughters started?
There certainly may be situations in teenagers that might need some assistance or some explanation from a gynecologist in the teen years. But really, as far as pap smears go, women really don't need a pap smear until they're at least 21.
Okay, and then just how is it treated? A brief way of how you have to go, what things you have to go through.
Well, if we can catch the cervical disease before it becomes cancer, we have all sorts of options. We can use remove the area where it's abnormal. We can treat with cauterization or things like that. We can even freeze the cervix, are ways. Once it becomes cancer, then the options are kind of a little bit more limited and a little bit more drastic.
Okay, well, thank you for that information.
Okay.
If you want more information on the cancer screening or anything to do with Cabell Huntington Hospital, you can always head to our website, WSAZ.com. Click on the Moms Every Day link. They'll have this interview. It'll have even more information that you can search. And then obviously we do have our app, so you can search that, download that, or follow us on Twitter at Moms Every Day. Thank you so much for joining us. We really appreciate it. Some great information.
Thank you.
Have a good day. We'll see you tomorrow.